All right, y'all. So I just found this story on Reddit and I want to read it. It's called the worst dentist or the worst dental experience. And I don't know if any of you all have had bad experiences. Just so you know, I'm not making fun of anything or minimizing anything. I'm just going to read it and we're just going to go over stuff. So if you see me, I'm going to be looking down because that's where I'm reading from. Okay, so here goes. Just had the worst dentist experience of my life. I truly feel violated. There's an edit on there, so I'll read the edit at the end. I'm sorry to vent, but I need to tell someone / everyone about the traumatic experience I've just been through. I will do the short version. I'm a dental phobic, always have been. Yes, it's irrational, but it is what it is. At least I dragged myself to the surgery. I went. I get it. Sometimes it is hard. I have a lot of patients that are super nervous. It's not abnormal. I know some people are more nervous than others, but I get it. People tell us every day that they didn't want to come see us. Or if you say, how is your day going? They're like, I'm at the dentist. And I'm like, hey, I'm sorry. But yeah, I get it. Dental phobia or dental anxiety is real. It's not a fun place for a lot of people. I told the dentist I was terrified, but I would do my best. She didn't respond. Instantly put me on guard, which, yeah, she probably could have been like, hey, you're in the right place, we'll take care of you, just let me, just a little reassurance would have been helpful. But I guess she didn't do that. She x-rayed my teeth and told me my broken tooth, the source of the pain, was infected and there was a deep abscess she needed to drain. I instantly started shitting a breeze block. This sounds not fun. I am not prepared. Okay, yeah, let's keep going. So yeah, if you have tooth pain, I guess there's a broken tooth, looks like there's an abscess, it's now infected. I don't know how long this tooth has been broken, but it makes sense. The tooth that's been broken may not start bothering you right away, but eventually, because it is a tooth, there is a nerve, eventually it can get infected and start hurting. And once the infection is very enlarged, the dentist sometimes may have to drain that and then take the tooth out as well. And then she proceeds to drill into my painful infected tooth without any anesthetic whatsoever. This is in caps, without any anesthetic whatsoever. And I'm getting lightning bolts as though Palpatine is met at my mouth over and over until I stopped her and insist on numbing, almost in tears at this point, as a 40-year-old massive block. She says, if you want, then injects me 3 times, which is agony because my gum is inflamed and infected. So first of all, my reaction to this, honestly, is this. I'm not saying I don't believe him. I believe him because obviously he said this is what happened to him. But I just fail to understand or see how can a dentist really just start working on somebody without getting them numb. The only time that I have worked on somebody without them being numb is because they insisted they did not want to get numb. At this point, I'm now anxious because now I'm the one who is on edge because I'm like, oh my God, are they in pain? Are they hurting? Are they whatever? But it's just interesting to me that 1, the dentist did not numb this person. And 2, I guess you're in a vulnerable spot and you're laying back. But 2, you just sat there and let them drill on you with, that sounds insane. If that ever happens to you, please stop them, and maybe leave. That's all I'm gonna say. It's just crazy because you hear all these stories of people with, oh, I went to the dentist, and sometimes we joke around and we're like, I wonder, because everybody, I've heard the story more than once. I can tell you more than probably 5 times or 10 where a patient comes in and they tell me, oh, the dentist literally sat on my chest and pulled, as they were trying to pull my tooth, and I'm like where are these dentists that are sitting on people's chests? Because I haven't seen them. But hey, I believe you guys. I do. It's just that I need to see these people so that they can explain to me what's actually going on. Because when I can't get a tooth out, I'm just like, hey, we need to send you over to the oral surgeon. That's what I do. But hey, I guess some people resort to sitting on chests and stuff. I don't know. And then she was like, she doesn't wait a second before carrying on drilling. I stop her and ask, shouldn't we wait for the numbing to kick in? And she shakes her head and says, it won't hurt. This won't hurt. I promise. I'm not laughing at him, but it's like, so the doctor says, this won't hurt. I promise. It hurts a lot constantly. She won't stop. I can smell burning, which I'm assuming my tooth is being decimated with this power tool, and the pain is horrendous. I'm actually crying at this point involuntarily. So yes, if you are in pain and a dentist is working on you, you should stop them. I know sometimes it's one of those, you feel like it's vulnerable, someone is in your mouth, you feel like maybe should I stop them, should I not stop them? Definitely stop the dentist. Stop us. I always tell patients, hey, if you're in pain, raise your hand, let me know. If you don't let me know, I don't know. But obviously, if you start crying, I may be like, hey, are you okay? You may be surprised. I didn't mean to say that loud. But you may be surprised that there are people. I've had some patients that will be like shaking, squeezing everything. And I'm stopping every 2 seconds. Are you okay? Does it hurt? And they're like, no, it doesn't hurt. I'm like, so why the hell are you doing this? You're giving me anxiety. Stop. If you are not in pain, then so sometimes it can be hard to know if somebody is truly in pain, or because some people are just that anxious though, to where yes, they're not hurting, but their body is giving mixed signals. But in this case, it seems like the dentist was like, hey, first of all, they didn't numb before they started, which sounds horrible. And I'm like, how would they feel if somebody started yanking on their gums and their tooth without anesthetic? That would be torture. I would never do something like that to anybody. And I don't expect any decent person, any decent dentist out there would do that. But honestly speaking, if you're not numb, anything is hurting, stop. Even if it means you're going to say, hey, we're done here, I'm leaving, you should be done. Because regardless of the situation, it is your mouth, you're in charge. Don't take this kind of shit. And I get in pain and whatever, so you're like, which pain do I choose? But that sounds like a very traumatic experience to me. Very traumatic, I should say. And then it says, I'm involuntarily shaking, not trembling, full on lost control of my motor skills, legs flailing, trembling, I cannot control it. It ends up ending after about 20 minutes. And I left so angry, delirious with the pain and genuinely feeling violated. I sent a strong complaint and I won't be going back there. I am so mad about this. I simply did not deserve that. You did not deserve that. Sometimes some people, if there's so much infection, no matter how much anesthetic we give, sometimes the tooth does not get numb. And in those circumstances, I tell the patient, hey, I've given you a lot of anesthetic, you're still not numb. Sometimes it's just the infection that's making it to where it doesn't numb. Let's put you on antibiotics. Let's have you come back in a week and let's take the tooth out at that time. Just because sometimes it's not that you're not numb. Sometimes it's just not because it's just highly infected and you need, it's not all cases. Those are actually on the lower end. A lot of my patients, even if they have a little infection and stuff, or even if sometimes they're swollen, we can get them numb and we can get the tooth numb enough to get it out. Because the only thing that's going to actually get you out of pain is removing the source of the pain. So it's going to be either taking the whole tooth out if it cannot be saved, or if it can be saved, doing a root canal on the crown. But antibiotics is just a matter of just buying us time, all that stuff. But at the end, we have to remove the source of the pain. But it is normal for you to still get anesthetic and still get 3, 4, 5 shots of anesthetic and still awake, still hurt, your lip still feel, if it's the bottom, your lip feels numb, everything feels numb. But as soon as that tooth is touched, it's just like, hell no, I'm not about that life. So in that case, we just give you antibiotics and have you come back in a week or something like that. But yeah, no, I don't blame this guy for feeling violated at all. It sounds like a very traumatic situation. Yeah, this is how I see how people would never go back to the dentist after this kind of situation. I don't blame you, guy. And it says, to add insult to injury, she beat me to a car on the way out, clearly in a hurry to leave. Yeah, that sucks. So then now it makes it seem like the whole thing that happened because she was trying to leave and go home. And it's one of those, I get it. Sometimes you get a last minute appointment, you're sometimes you want to do, you're like, God, I want to leave. But I think it's better to just reschedule somebody instead of just being like an ass. That's my thing. I wasn't there, so I can't judge either way. I'm just reading based on what's on this page. But I definitely wasn't there. But if this is how it happened, it was definitely uncool. These people should really respect when people are open to them about their phobias and anxieties. And if they aren't respectful and at least a little bit compassionate, then they shouldn't be allowed near people's mouths when they are so nervous and vulnerable. I bet I was lucky, but now I worry I'm just going to be mistreated every single time. Sorry, thanks. Yeah, it sounds sad. It sounds sad, and honestly, if someone like this had this experience, I can see it now. You were already anxious and whatever, and now this just justified the whole point of it. And that's the part where it's like, hey, if you're having a hard day, it's kind of hard though. If you're having a hard day and you're like, I need to leave, I need to go home. But then at the same time, you have a patient that came in, they need to be taken care of. And then if you tell people, like, if you tell the patient or if you have them tell them, hey, I can't see them today because I'm having a bad day. Because sometimes also, I'm not saying this is justified, it's not. But sometimes people forget that dentists are human beings as well. And sometimes when we're not feeling well, it's almost like, oh, so you're just gonna leave. Yeah, I need to leave because I'm not having a good day. Or yeah, I have an appointment, I have this. But when you stop treating your dentist like they're human beings and they're machines, sometimes things like that happen. Or maybe there's pressure of, I don't know, there's no reason that this person should have been treated this way. And on top of that, they're already anxious. And now this just cemented the whole idea of, hey, I had a reason to be scared. And then this happened and now I'm more anxious. And now maybe they can end up staying away from the dentist. And then we know that if you don't go regularly, then now whenever you go, you always go in pain. And when you go in pain, you need more to do. So you never go when you're just getting a cleaning or something simple. So every time you keep having this recurring thing. So it's just a cycle that we really need to break on both ends. Sometimes when people are nervous, I'm like, hey, some people will say, hey, and I try to be respectful of that. Like where they're like, hey, I just came in to look and see what's going on. Because some people need to work themselves up to do the treatment. So sometimes they'll be like, hey, I just came to see what's going on. I'm anxious. I need to prepare myself. And then I'll come back and do the procedure, the thing that we talked about. I try to be respectful of that and say, hey, that's cool. We can do that. But at the same time, guys, we also need to take care of our things. Because if you just keep pushing it and postponing, then you're going to be calling and be like, I need to come in today. And it's a Sunday at 2 a.m. And I'm going to be like, hey, I'm sorry, I can't come here now. Then now you're going to be looking at me saying, oh my gosh, you don't care. But it's like, hey, we talked about this for the last 7 years and you didn't do it. And now you want your emergency to be my emergency. I know that sounds a little mean, but I hope that I'm making a point. This dentist, the way they handled things was not cool. And we just cemented this person's phobia. But at the same time, like, being out there, let's try to go to the dentist a little bit more often, because the more you focus on prevention, and then you can come and have better experiences. And also as the patient, know that you are the boss. Like some people, it's just like people say, hey, it's kind of like dating, or it's kind of like therapy. You're gonna have to try a few different places. You may have to try a few different places to see who you like and who you don't like. There's some people who hate my guts, who think I'm the worst dentist in the world. Some people that like me. I do my best every day, and that's what I always feel like. I do my best. I feel like there's very few people who wake up in the morning and say, I'm going to go do a shitty job. So do my best, but just know that I'm human, give me grace. But I've never been human to so much to not numb anybody. But you know, if that ever happens, please stop me and be like, hey, I'm out, or hey, this is crap. So just don't forget that we are all people, whether the patients, whether whatever. Sometimes we get so used to it, we get so comfortable because we work in the dental office, we get so comfortable and everything is just not a big deal. But we also have to understand that for these people that are walking in the door, it is a big deal. It is a big deal for them, and it is their mouth, and they're anxious, even though we know that there's nothing to be anxious about, even though that, oh, this tooth isn't gonna come out easy, or even if we know that this is just a filling. To them, it's not just a filling, it's a big deal, and we need to listen to that, and we need to be compassionate about that. And if we're not having a good day, sometimes it's okay to just reschedule. Sometimes it's okay to put it for another day. And for our patients, it's also important for us. Seems this guy, from the way he wrote things, he seems like a decent, nice person. The edit that he had after this post was, my wife's dentist, who she says is brilliant and considerate, has agreed to see me in a few days and has promised to sort me out and talk everything through. My wife is fuming at this whole thing and thinks I should sue. I don't know about the suing thing. I guess that is not my place, because there's a lot, like I said, there's a lot of he said, she said, so I can't really say what really happened and what should have happened and what could have happened. But I feel like his wife has a dentist who's brilliant, but it seems like maybe he wasn't able to go to this guy because he waited until something was an emergency to get it taken care of. And I get it, the anxiety stuff kept him away, but also when the anxiety keeps you away, then when it's now last minute, you're going to the last minute place where wherever is open, you have to take that. Whereas when you just treat things when they're not an emergency, then you get to pick somebody who maybe you've been referred to, or you get to do more research, as opposed to, hey, it's Friday night, I'm gonna just find a place that's open on Saturday, because guess what? Not many places are. And now you're maybe stuck with one of these dentists, the worst dentist in the world. So you guys, make sure you take care of yourself. I know being at the dentist is not fun, but just remember, if you catch things early, you can prevent a lot of stress. You do less treatment. Sometimes stuff that doesn't even get numb, you don't even need to get numb for. So if you have any questions, though, let me know. Let me know what you think about this story. Has anything like this ever happened to you? And yeah, thanks. Enjoy.